Okay, and then I'm going to start with some housekeeping stuff. So welcome everyone to the Undergraduate Research Education Series. Welcome back if you've been to one of these sessions before, if you've watched a video of it before. We're very happy to have you as part of this conversation today. If you are attending in real time, you don't have to fill out the Education Series evaluation form. It's optional. I'm going to drop it in the chat just in case you would like to give us some feedback, because that's always helpful, but you don't at all have to do that. For those of you watching the recording later, please do fill out the evaluation form. It is how I can track your after the fact watching the video attendance for your UROP requirement or whatever other requirement it might be fulfilling for you. And with that, I also want to start us off with a land acknowledgement. So the American Indian Resource Center and Ella Blanchard, who I mostly stole this particular land acknowledgement from, lead the way for me to acknowledge that the land that the University of Utah resides on has always been on Indigenous lands, specifically on the lands of the Shoshone, Paiute, Goshute, and Ute tribes. It's also imperative that we acknowledge the enduring relationship that exists between Indigenous peoples and their traditional territories. Through this land acknowledgement, I want to express my personal gratitude and appreciation for their persevering to protect this land for future generations. The erasure of this relationship between Indigenous peoples and their traditional homelands is an insidious form of ongoing colonization, and we need to build our mindfulness of this and of other Indigenous protocols. And of course, the best way to respect Indigenous peoples would be to give the land back. And with that, we will, I will introduce briefly our two discussants. I don't know, because it's more of a conversation style. So we have Dr. Jackie Eaton and Dr. Gretchen Case. I believe, now that I'm starting to talk in public, I've forgotten, both in the College of Nursing. No. Dr. Eaton is in the College of Nursing.
I'm in the School of Medicine. Yeah, but it's okay.
And they're gonna talk about demystifying myths about disciplinary practice, interdisciplinary practice, and it's going to be more of an engaged conversation style. So feel free to unmute or type in the chat whichever form of leaving comments or asking questions that you would like to. And with that, take it away.
Thank you. Okay, so we're so happy to be here today, and I'm going to get us started. I actually have I'm going to share my screen. We're going to do a short poll as a group to kind of get an idea for who is here and some of our assumptions as a group. So if you could join, you can either use this hashtag. You just go to slido.com and then you type in this hashtag number, or you could use the QR code. But we're going to start with a short little quiz, and we are going to get a sense of what disciplines we all come from. And when I say disciplines, it has to do with what major are you in? And so I just chose some here. If the ones that you are specific with don't land under any of these categories, feel free to choose other. Okay. Hey, that's great. We've got some from the natural and applied sciences, social sciences, and some from other, which is probably quite a few other areas. That's great. Okay. Let's go ahead and do, whoops. All right, I don't know why I showed that. Okay. Let's do one word. Type in one word. How would you describe research in STEM? We want to kind of explore some of what we know or think about research in different disciplines and different areas. And you can enter multiple words if you like. You can enter multiple times. You don't have to just enter one word. All right.
Man, that's hard to condense down.
Oh, totally. I agree. So just
I didn't get one in time.
yeah, think about different words and just throw multiple words in. That's totally fine too. Let's see. So here's some of what people have said: concise, rigid, challenging, technical, iterative, complicated. Very good. This is good. Okay, oh, here we go. Foundational, translational. Very good. Okay. And then our next question, in one word, how would you describe research in the social sciences, humanities, and the arts? I'm not going to show the results till we get some words in there. Okay. And I know it takes thought. It's not immediate, but let's go ahead and see what we see here. Cultural, contextual, fluid, ambiguous, studies, communicative. Very interesting. Okay. So we're going to stop the poll there. I'm going to stop screen sharing. What did you observe in the differences in our assumptions between research in STEM versus research in the social sciences, humanities, and arts? And you can unmute, or you can type in the chat. Both are perfect.
It seemed like words describing research in STEM were more focused on like the difficulty and complexity, and then things focused on the humanities and arts kind of seemed fluid. This kind of seems like the right word to kind of describe all those, like a little bit all over the place, a little bit like subjective, like just a lot of variables. It's a lot harder to nail down.
Yeah, there was a definite clear delineation between our assumptions about STEM research and our assumptions in other areas of research. Definitely. I think that was pretty clear. Any other comments or thoughts about those differences that you observed? So I think it's a great start to demonstrate what Gretchen and I are going to talk about today. So I'm going to give you a brief overview of what to expect. We are first going to explore a little bit about our own journeys in interdisciplinary research. And then we're going to open up the time for some question and answer and some discussion. And I'm actually going to let Gretchen introduce herself when we get to her point. I'll start with my story. Then we'll move to Gretchen's story, because we both have a very unique approach to how we have come into research and how we got here, and the different areas that intersect in the type of work that we do. So one thing I wanted to share is that in this world of research, when you're working across disciplines, there's different terminology used. Sometimes you'll hear the word interdisciplinary, you might hear the word multidisciplinary, transdisciplinary. All of these words actually have slightly different meanings. And for our discussion today, just know that whatever interdisciplinary, transdisciplinary word that is mentioned, we are just talking about working across disciplines, no matter the way or the method. We're just going to do a broad umbrella. We're not going to get into the nitty-gritty of it. Oh, and I wanted to say that in the chat, Sabrina added, research in STEM seems linear, is linear. It does seem linear, doesn't it? And like you jump into a rabbit hole on a specific topic, but humanities can cross into other subjects. Okay, thank you, Sabrina, great comment. So I'm just going to start and give you a little bit of background about my own trajectory. I have an undergrad degree in theater. I have a master's degree in gerontology, and I have a PhD in nursing. However, I am not a nurse. I am not a licensed nurse. And I have never practiced as a clinician. So when I was in high school, I was good at theater. And I thought you went into college and you did what you were good at because it was easy. Not just because it was easy, but it was easy because you were good at it. So that's what you should do. That was like, these were assumptions I had as a teenager. So I went to college in theater. And every summer when I went home to work, I actually ended up getting a job in assisted living, taking care of older adults. And I loved it. And the reason I loved it was because every individual was so unique and their stories were so different. And my challenge and the greatest happiness during my work was learning about their stories, who they were, and then trying to find ways to remember what they appreciated, what they liked, and who they were. There was something about that person-centered approach that appealed to me. And there was one woman who I took care of, who at the time I didn't know this, but she had dementia. And she would walk around the halls saying, "I'm so sick, I want to go home." And she would say it over and over and over again. And I was always scared to be assigned to her because she was very, very combative and aggressive. And it felt almost like being on the defensive. It was very difficult to care for her, to change, because you would get hurt, you would get scratched, you would get bit, you would get, anyway, it was very difficult to do because you were trying not to hurt her in return. And so I started asking her questions, things like, "Hey, what do you like to do?" Just questions about her life. And she never responded, ever. And finally, one day I asked her about a song. What do you like to sing? And it didn't work. And over time, eventually one day, asking her the same thing, she started singing to me. And she started singing a song that went, "I'm coming home, I'm coming home, I'm coming home today, for I long to see the old folks again. I'm coming home to stay." Now, it took a long time for me to get the whole verse. It was over time. She didn't sing it all that first time. But I learned this song that she knew from when she was a child. And so I started singing it to her every time I had to change her. And it became this method and this tool that I would use in care so that I didn't get hurt and so that she would have a calm, subtle experience, a positive experience, not a negative, defensive experience, changing clothes, getting ready for bed, brushing teeth. And it became my tool, a tool I had in my toolkit. So I knew as I did this job that I wanted to go into gerontology, which is the study of aging. And where I was going to school, there was no degree in gerontology. So I went and got a master's degree in gerontology. And at that stage, I didn't know what a master's degree meant. I didn't know it meant research. I didn't know any of that. And I showed up and I jumped in and I got to work with a faculty member on her research. And I learned qualitative research. I got to go into multipurpose senior centers and I learned to do field notes and observations and in-depth interviews. And I learned to explore the environment's influence on behavior. And that was my master's degree. And then after that, I went on and Shaylin said she worked as a CNA for most of her undergrad, even though her degree is in geography. And I've many similar experiences to the one you're explaining. That's awesome. Yeah. So it's funny how our life experiences, right, interact in ways that lead us to do things that we may not have ever imagined ourselves doing. I ended up in a PhD program that was in the College of Nursing here, actually at the University of Utah. And they had a cohort that they brought in 9 students who were focused on gerontology. And I was the only non-nurse admitted to this PhD program. And I was terrified. I was terrified that they would look down on my arts background. I was terrified that they would see it as a weak, that they would see it as not important. And I was terrified because their vocabulary was completely different from mine. And I remember that first semester speaking up in one of the classes and saying, "I don't know what you mean by health disparities. What are you talking about?" And they were so kind to me. They paused and they were like, this is what it means. And I learned later that they actually saw me as an asset to their cohort, because I would come forward in our discussions and bring up topics that they had never heard of. And that they looked forward to learning from me in ways that were different from what they were learning. So my approach to research took this very strange trajectory that kind of built up a foundation that allowed me to do something I'm very interested in, which is working with older adults and doing community-based research with older adults. So my PhD dissertation, and I'm going to wrap my story up really quickly, but it focused on how do we bring more nursing students into working with older adults. And I ended up combining all 3 degrees, where I collaborated with nursing students and older adults on creating a research-based play, which is called an ethnodrama. And those students created this ethnodrama based on their real words and interviews they did with older adults. And the culminating event was viewing their own words performed for them by a professional theater group here in Salt Lake City. And then a post-performance discussion of what that performance meant to both the older adults and the students involved. And it ended up being a mixed method study, not just qualitative. We looked at longitudinal data over the process of how it altered student attitudes towards aging and older adult attitudes towards aging. So after I graduated with my PhD, I took the same model of creating an ethnodrama and translated it into the community with older adult caregivers. So family caregivers of persons who are aging, older adults. And we created an ethnodrama called Portrait of a Caregiver, which has been performed across Utah now. I partnered with caregivers in the community and the Utah Caregiver Support Program. I partnered with Walk-Ons, which is a nonprofit theater company here in Salt Lake, where they take theater to underserved populations. And the 3 of us worked together to recruit caregivers. The caregivers interviewed one another about their experiences. I analyzed that data. We turned it into this play. And then Walk-Ons has done professional performances for a variety of audiences to disseminate the research findings. So we have physicians, nurses, other family caregivers, politicians, policymakers, all coming to different performances to view the experience of caregivers in our communities. What are they facing? So theater has not only turned into a form of communicating research, but of also disseminating that research and doing surveys of audience members to better understand what it means to them and how we can better use this to promote the needs of family caregivers in the communities. One of my assumptions about my previous disciplines, my multiple disciplines, and the interdisciplinary approach I've taken was that it would be difficult for me to find funding, and that it would be difficult for me to find a way to ever get research funding from the National Institute on Health. Just this year in January, you guys, I received a K award from the National Institute on Aging for my research. It funds 5 years of my research, 75% of my time. You guys, that's a big deal. And yeah, it's a big deal because I had an assumption about interdisciplinary research that my research would never be funded at this level. So my point in sharing this is that you never know. If you have passion, you're working amongst multiple disciplines, there are ways to translate your work that can strengthen research that's out there. And I wanted to just, my last part of the story is the research team that I'm working with right now. So it's me, and I have this past, right, of theater, gerontology, and nursing. My research mentor is a psychologist. My other research mentor is a neuroscientist. There's a biostatistician on my team. There's a sociologist on my team, and a social worker, and me, all across so many disciplines to really understand how we can improve caregiver training using arts-based techniques. And that's my next steps in research. Okay, that's my story. That was a lot of talking. I am so sorry. I just wanted to show you that this trajectory is unexpected, but valuable, valid, and able to get research from high levels, and important. Okay, I'm going to be quiet. I'm going to turn the time over to Gretchen so she can share her story.
So first of all, I did not know you had a K award. So congratulations. That is a huge, huge deal, everybody. Like, just like, that's an Oscar. That's an that's an Academy Award. That's wonderful news. So I think one of the reasons, or maybe the reason, Jackie asked me to join her today is because I similarly have a very unusual trajectory, have ended up in a place that perhaps you wouldn't have expected. So I'm going to tell you a little bit about my background, and I'm also going to drop some names, and I'm only, same as Jackie, only going to drop them so that you know what's possible. So it's not because I think I'm awesome, it's because I want you to know like at what level research can be done. So my degrees, I have a bachelor's, I double majored in history and speech communication, which was a performance degree at my school. I have a master's in communication studies with a certificate in cultural studies, and I have a PhD in performance studies. Performance studies is something you might not have heard of. It's a very small discipline, but well established. And I'm going to explain it for a minute, because the important thing for you to know is that what performance studies does, it says that all humans are performers, and we perform on stage sometimes, and we recognize that as a play or an opera. We perform in everyday life. So right now I am performing for you the role of an academic and someone giving a talk. And if my husband or my child comes in, I'll perform mom or wife, right? And that may happen, who knows? But we have different roles, and those are not cheating or faking. It's just that we, depending on our audience and the scripts we're responding to, we perform different ways. Humans are performers. So it's a lens of looking at the world. And where I've landed is I use performance as a lens for looking at the practice of healthcare and medicine. But I told you all my other degrees, those all matter too. So I've always been a very interdisciplinary person. And in fact, when I graduated from school, from college, I worked as a public historian. And work as an historian is not easy to come by. And I always like to tell this story too, just to give you hope as you graduate. I graduated into a recession. There were no jobs. So I temped for a year, and then I moved to DC and I temped for another year while I looked for jobs. But this was back when there were phone books. I looked in the phone book under history, and there were 2 companies listed, and I wrote and called them every month for a year. And finally, one of them said, please stop calling us and come in for an interview. And I went in for an interview, and they ended up hiring me, because once I got the interview, they let me in. But just a little lesson in persistence and figuring out, like, if that's what you want to do, that's what you want to do. As a public historian, that meant that as opposed to an academic historian, I was not working at a university or a college. I was doing real research in the real world. Not that the university is not the real world, but I was going to archives, I was going to libraries, I was going to small collections. I did research, I became an expert on nuclear history, nuclear medicine, and nuclear physics. I became an expert on all things science, really. And that was in part because I started college as a biology major, and I thought I was going to be a biologist. And then I took my first college level biology lab class and said, I don't want to do whatever this is. I want to do something else. But I was never afraid of science. I was never afraid of the language. I was never afraid to talk to scientists. And so when I became a historian, they gave me the science stuff, because they knew that I would, if I didn't know it, I would look it up. And yes, I can explain to you how a nuclear reactor works. I would have to kill you later, but I could explain it to you, because I had to figure that out for my job. Because part of my job, one of my jobs was working for the Department of Energy and putting together a historical database, right? I also, because I had proven that I was a historian, but I was able to speak science, I was given this great job at the National Cancer Institute. So the first contract, because I worked for an agency that contracted, the first job they gave me was to kind of revise and refresh the history of the National Cancer Institute, which at that time had been about 50 years that it had been open. At that time, the person who asked me to revise the history was like, a lot of these people who are around for the opening, it's been 50 years, they're getting towards the end of their lives. and they're not going to be with us much longer. And a lot of what they know is not written down. Would you fly around the country and interview them all? And so I did. So my job became flying around the country, finding all these people who had founded the National Cancer Institute, who had I interviewed the scientists who invented the cure for leukemia, the current treatment for leukemia, Emil Frey and Emil Frey. I got to meet all these amazing, amazing, amazing people and record not like what their CV said, but what, like, where were they when they had this idea? Why did they work together? And like Frey and Frey, it's because their last names were so similar that they met each other, right? Like as a joke, and then realized they had things to work on. So I got to do this amazing project. And in the process of doing this project, doing these oral histories, so collecting these oral recollections, I realized something that now is just so obvious to me, and that is that medicine and medical research is a culture. It's its own culture with its own rules, its own language, its own way of being. You have to kind of join the culture. You have to learn the language. You can be an insider or an outsider. You can be parts of subcultures. And I was really fascinated by this. And I knew that I would need to go back to school to figure this out, to learn more about this. And so that's how I ended up going and getting a master's first in communication studies and a PhD then in performance studies. And the process of choosing my master's and my PhD was quite complex. And I will boil it down to, I looked for people who understood what I was saying and wanted to help me figure it out. So it was less about what program, like I looked at history programs, and that for what the questions that I was asking, those were not the people who said, yes, I understand what you're saying about culture. Let's work on this. It was people in communication studies and performance studies. So just something else for you to think about when you're thinking about doing interdisciplinary work. It often doesn't matter what, like if someone calls themselves a historian or a sociologist or a physician or whatever they call themselves, are they thinking with you on the questions? So because I had all this work that I had done at the National Cancer Institute, that's how I proceeded. There's a lot more to say there, but with my master's and my PhD and what I decided to do my thesis and my dissertation on. But my research from there on out became about this idea of medicine as a culture and performance as a way of seeing how people play roles, how scripts are written, why people do what they do, why physicians, and I'm in the School of Medicine, so I focus more on physicians than I do on nurses, PAs, and other folks, but that's not to the exclusion, it's just kind of where I am. Why physicians behave as they do, why medical students behave as they do or learn to behave as physicians. That's been some of my research. Why patients behave and perform as they do. What is the idea of a good patient and what is the idea of a bad patient? Throughout all of this, so after I did my PhD, again, it's just a lesson in persistence. I spent a year adjuncting, just so you know, like when you graduate, you sometimes don't get a job right away. So I spent a year teaching theater because I had that tool in my pocket, right? So I spent a year teaching theater. Then I got a postdoc in medical humanities at Northwestern, right? And then I got a postdoc at Duke in writing because I had that skill as well. So I taught academic writing, but I taught academic writing about medicine. So in every case, I was like, how can I bring this back to the questions I want to ask and I want to answer while serving the job that I have or the position that I'm in? All of this along the way, because I was so fascinated with medicine and the culture of medicine, I made sure that I was teaching in medical schools, even if that meant volunteering. So I taught at UCSF, UCB, so the joint program in medical, joint medical program, University of California, San Francisco, University of California, Berkeley. They have an incredibly well-known joint medical program. I volunteered to teach there. I taught an elective. When I went to Northwestern, I taught at that medical school. When I went to Duke, they didn't need me at Duke, so I volunteered to teach at UNC Chapel Hill. So that I was always teaching in medical schools and making sure I understood and was still like present in medicine. No matter what I did, I found physicians to round with, and rounding means you follow, like for in hospital, you follow the team around as they see patients. I went to clinics. I followed doctors at clinics. So I was constantly kind of focused on, I'm still interested in medicine. I might be teaching writing right now, but I'm also teaching in a medical school. I'm also rounding and following physicians. What that meant was that when this job came open at the University of Utah to teach medical humanities, is I was able to say, I am not one thing, I am all these things. I have crossed all these disciplines in all those ways. And that's what they turned out to be looking for here. And we can talk more about what medical humanities or health humanities is, but it's a lot of things. And some schools have lots of people who do arts and humanities related to medicine and health, and some people only have a few. And we only have a few. So it became very important that I was able to do lots of things. So if I don't know something, I find it out. So my background's in theater. I love dance. I don't know a lot about dance, but I know how to partner with people in dance. I know how to partner with people in fine arts. Like that could be a whole other thing, is how to partner with people. Because we're talking about research though, what I learned immediately is what it means to do interdisciplinary and cross-disciplinary research. And I learned this way back in undergrad and when I was working as a historian, is you do not show up and say, I have this idea and I need you in this other discipline to do my thing. You show up and you say, what do we together think about this question? And this alludes to what Jackie was saying about like the benefit that she brought to a cohort or to a classroom, is you bring a question that you say, I can't or don't want to figure this out on my own. I want to figure it out with people who have different backgrounds, who are thinking differently. And together, we're going to come up with a way to approach this question. What never ever works is if someone from the sciences shows up to the humanities, vice versa, social sciences, whatever, and says, we have this thing and we're supposed to be interdisciplinary, so we need an artist. Come here and be an artist. What works is when you show up and say, here's the question. What are we going to do? And a lot of times where you start is someone in the room says, that's not the question. That's not the right question to ask. And you start building from there, and you learn each other's language, you learn each other's culture, you learn how that research works. This is absolutely rigorous. I was writing down some of the notes that you guys had about arts and humanities versus STEM. I think there's a lot of ways that people assume STEM is rigorous and linear and that everything else is not. That's not true. It depends. But the work that I've been able to do across disciplines has led me to funding from National Institutes of Health, National Endowments for the Humanities, and the National Endowment for the Arts. And all of those depended on what the question was and what we were trying to get at. And for example, I got a big with my co-PI in the Department of Theater, a big grant from the National Endowment from the Arts that had been turned down by the NIH. Because they just didn't hear the question the same way. It's the same project. It's about who was ready, willing, interested to fund it, and which place was excited about what we were going to do. We could probably turn that around again. Like we could have something that would be turned down by the NEA that the NIH would then take the next year. So thinking of research as being about the question, being about the team, as opposed to these silos is really, really important. So if you have a science thing, maybe the NIH is going to fund it, maybe the NEA is going to fund it, and vice versa, right? It's about the question. Research is always about the question, and then you build your team depending on what you think will get you to the result you want. And that's a whole thing we can talk about too. So I'll leave it there. What I am currently is I'm an associate professor in the Department of Internal Medicine and the Department of Pediatrics. I'm not a physician, but that's my position. And I'm the chief of the program in medical ethics and humanities. Neither of those are things I would ever have thought would be on my business card. And yet it is the perfect place for me to be right now with my background. So I'll leave it there and then we can open for discussion.
Thank you, Gretchen. That was amazing. I didn't know some of the details of your story, so that was kind of fun to hear. Okay, so one of the things that I'm hearing, and as I'm saying this, is if everyone will just start thinking about, do you have questions? Do you have thoughts? Are there things in these stories that have made you think differently about anything. Gretchen emphasized the importance of the research question, building a team based on the needs of the research question, just like you build methodology based on the research question, right? The methodology, so sometimes we hear this qualitative versus quantitative research, right? Really, that's not a thing. It depends on the needs of the research question. What is the question you're asking? What is the research you're trying to do? And then you develop methods to help you answer that question. Both methods are appropriate. All disciplines are appropriate. The team you build depends on what you need to do. Yeah, so as you guys are thinking what questions, feel free to speak up. I wanted to highlight a few of the myths that came up as I was listening to Gretchen. Team science is a strength, working across teams, but you have to build. You have to build that team together. That's not an easy thing to do. There's different ways of knowing and different ways of looking at the world. And so building a team that allows you to look at multiple ways of looking at the world can help answer complex questions. And let's see. Some of the myths is that certain types of knowing are less than others. Certain ways of knowing are less than others. But really what we just want to do is we want to know, and some questions require different types of teams and different ways of working together. Let's see. So I have a question for everybody here, the group. I'm wondering, in your experiences and as you have either observed research teams or in your experiences as UROP students or in your experiences observing others, did you see any benefits of working across disciplines? Have you experienced that as students? Have you experienced that yet in your education?
Yeah, I have in my own, with the lab I work at. We have a lot of different people coming in from disciplines. I'm from mechanical engineering and computer science. The partners we work with are all material science engineers. We've got some postdocs and whatnot, and we're all working on a computer-based problem. So we're coming from very different backgrounds, but fundamentally we're all looking at the same thing and we all view it a slightly different way. And that's like typically what we need to make the project work, is just all of us know something that the other person doesn't, and coming together on the same issue usually ends up being kind of the sum is great. Like the result is better than the sum of the parts in some situations.
I love that. Thank you, Sam.
I also work on a team called at the University of Utah, the Center for Natural and Technological Hazards. So I work with graduate students, and there's us undergraduates as well. And there's a few different backgrounds, mostly like geography and sociology. But when you guys mentioned building a team based on the research question, I am after I graduate, I'm heading into a PhD program at ASU, and that just kind of sparked the thinking about committee members and things like that. And I think it's really relevant to that specific scenario as well. Building people from other disciplines on your committee that will work to help you in specific ways is really important. So thank you guys for discussing that.
Yeah, that's a great example. Gretchen, sorry.
Well, I was just going to say, I strongly recommend that you get your outside member of your committee, your dissertation committee, from as far away from what you're doing as reasonably possible. So it should be someone that's connected to what you do, but if you can get someone who is really outside your discipline, not just like a sub-discipline, They
Yeah.
will ask incredible questions and push you in new ways. And I think that I just, if that's at all possible and allowed, like if you can get someone, I don't know what you're going into a PhD for, but if you can get someone from anthropology, because they understand the question, they will ask you things that will take you in wonderful new directions.
Yeah, the conversations I've had with like my co-chairs at ASU, it seems like it's strongly encouraged to branch out into other colleges and find like mentors that still will work well, but have like a different perspective. So I don't know, it's exciting, but yeah.
That's really exciting, Shaylin. Congratulations, by the way.
Thank you.
Really exciting for you.
Congratulations. I also think it's important to just quickly say, this is what the university is supposed to be. This is why we have universities, is we have people, like the disciplines are artificial. Like someone decided this is history and this is literature and this is science, but they really all, like, we are all supposed to be coming together thinking about what is this world we live in and why, and what does it do and how can we solve problems? And the reason we're not doing those separately is because we're better together. We're thinking together.
I love that. Well, and what goes along with that is I will never know everything about my area of interest. It doesn't matter how hard I work. That is impossible. So I absolutely acknowledge that I don't know everything, that I lack quite a bit of knowledge and I'm going to need help. And it is my plan to acknowledge that throughout my entire trajectory, even when I become a professor. When I get to that point, I still will not know everything. And I still will need people who have different ideas and views to strengthen what it is I do. What else? What other experience? Oh, go ahead.
Well, I was just going to add, and you shouldn't and you don't need to. So I'm thinking like, so I work with a biostatistician too, right? And I'm just going to flat out say like, I don't get statistics, don't care to. Like I know it's important, but I also know that our biostatistician can do a better job of that and understands it and lives it and breathes it and makes it like adds to our team in a way that if I had to sit down and learn all that, I wouldn't be using my skills and my interests where I am. So it's not only okay to not know everything, but like, so you do your thing and let your teammate do their thing. And you're better together. I didn't mean to slam biostatistics. I just like, every time he says stuff, I'm like, you're a genius. What's the number I need? Because I don't know how he got there.
Oh, that makes sense. Well, and what you just described, Gretchen, adds rigor and transparency and reproducibility to the project, right? So because you have individuals who are experts in their areas, really adding that rigor to the overall project. Some projects can be massive and very difficult to manage as one individual. Yeah. What else? Has other people had experiences or observations they've made about this type of work?
Well, the way I kind of see our entire, like, the entire structure of the scientific community and even like the most rigorous of research is that everybody has a list of references that they're using in journals. Then, so I'm referencing a journal when I do something that will be referencing 30 other journals that we'll be referencing, and it's all, and the scientific community in general is really iterative because it's just, there's so much that you need to know to continue on. It's not possible for everybody to like, so do one thing. So you kind of need to like pick your one little niche and then iterate off of everybody else's work and stand on the shoulders of giants kind of thing.
Oh, 100%. What a great example. Gretchen.
And that is true in the social sciences and the humanities and the arts too, like also citing sources, referencing back to other things. I think of it as entering a conversation. So with every question I ask, with every research project I start, I'm entering a conversation. So because I want to be polite and professional, I first find out what the conversation's about and who has already said things and what's going on and what's left out and where I can add to the conversation. So if I'm always thinking about who else is in this conversation with me and who just came in and what did they add, that's a really helpful way for me to think about my research sitting amidst all the research of everyone else.
That's wonderful. Well, and that emphasizes the importance of meta-analyses and syntheses and literature reviews and really delving into, I mean, that is an important piece of research, right? Pulling together and really assessing what's already been done so that we don't reinvent the wheel, or so that we can retest it and find out, hey, is the way this was done previously correct? And how can we build on it? What a great example. You also, everyone made me think about this other situation that's happened recently with some of my community-based research. Some of our community partners are doing some things in their, caregiver support groups, in their meetings that they see really to be effective. They have anecdotal evidence of things working, kind of like the anecdote of me singing, right, to this individual with dementia as a tool to help me care for her. They're in there, they're doing the work with caregivers, they're in there teaching caregivers. They see how effective these things are. Someone recommended some of these systems to me, and I started looking in the research literature to see if I could build it into my literature review and to see how I could build on it. No mention of these techniques, no mention of this official program that is out there being sold. It is actually a program that has never been tested scientifically. That's not a problem. However, they can't say that it's research-based, evidence-based, and we don't really know what outcomes, what the actual outcomes are of this program that's being applied in the community, because it's never actually been tested scientifically with a control group and with the waitlist control. So it's another reason why we have to partner. We have to partner with our community partners and the people who are applying things, because they know how to apply things. They know how to work things in the community and to be there. They don't know about the science. They don't know how to test things to really understand the outcomes. And I'm not, anyway, so it needs to be a partnership, right? Across. Gretchen, you have something to say. I can see it.
Well, I mean, this is the NEA research that I'm doing. Is there are a lot of people who use theater techniques to teach, and especially theater techniques to teach in medical school. And all the literature that's out there says it's great, it works. And so the NEA grant that I have with Sydney Chico O'Donnell in theater is to say, how do you know that? Because it's all self-report. So it's all people basically. So I do a theater technique with you all, and then I give you a survey and you're like, yep, it was great, it worked. And we know there's personal bias to if you agree to do something and then participate in it and you enjoy it, you think it works. So we're actually doing a more objective study of, did it meet the goals of the exercise, for just this reason? Because there are lots of people out there that are like, use this theater technique, it works. And we're like, how do you know it works? Like, works for what? What's your outcomes? So there's a real rigor in doing that. That's exactly what my NEA grant is doing, is saying, how do you know it works? And it's really annoying to people, right? Because they're like, because I know it works. They're like, but how do you know it works? But the other thing I want to say is what you're getting at also is something that is maybe transdisciplinary is the right word, but we talk a lot about research in the academy, in the university, and we leave out the community. We leave out all the people to whom discipline means nothing and research means nothing, because they're talking about their lives. They're talking about what they do. And I was just thinking about this morning about areas of the US where there's very low acceptance of the COVID vaccine. So think about all the things that went into the COVID vaccine development, all the research, the incredible teams, all this stuff. And then you come to the person and you say, I want to give you this shot. And they say, no, I don't want it. So like, more needs to be done. That research means nothing. That vaccine means nothing if it doesn't go in an arm, right? So how do you build transdisciplinary, cross-disciplinary, outer disciplinary, and say, why don't they want it? because this vaccine is useless if it's not in an arm, and they won't put it in their arm. So what's going on there? Like, to me, this is like the crux of why we need all disciplines, all people thinking together, because that question wasn't answered yet for these folks who don't want the vaccine. So that's my my soapbox for the day.
It's a good soapbox. Well, and I wanted to say something about some of the myths of research in STEM versus the myths of research in humanities, arts, social sciences. It is true that there are differences because we're asking different questions. However, a lot of the work that we do in across disciplines is finding ways to bring rigor to all forms of research. So one of the things on my one of the things I'm doing with my NIH funded research award is incorporating what is called the stage model of intervention development. And it's for interventions that exist in communities so that we can rigorously test community-based interventions. We can't test those in a lab, but there are actually rigorous steps that we can follow to test them in community settings, to really find out what is working and why. So there are ways that we approach these various disciplines and research in these various disciplines to add rigor and translatability to them. And sometimes we just don't know about it because we've never worked with that discipline, or we've never been introduced to it. So I think the point of today was just to introduce you to some of these ideas. It was intentional that Gretchen and I didn't bring slides. You know, I forgot to say this at the beginning, but slides are a language, and that oftentimes in science, they're a language of how we communicate what it is we're doing. And we were trying to remove a little bit of what we're used to so that we could just talk. I just wanted to ask, does anyone have any questions or any additional thoughts you would like to share, things you've been thinking about during this time? Oh, Sabrina wrote something in the chat. She said, I'm not well versed on the pathway past undergrad. Might be a conversation with an academic advisor, but when it comes to master's degrees, despite your major in undergrad, and after hearing your stories, can you choose a whole other discipline? You can. And completely switch, is it harder to get accepted or is it encouraged? Gretchen has something to say.
Oh, I was just gonna, you absolutely can, but when you're interviewing for a master's or PhD or MFA or whatever you're interviewing for, you need to understand why you're doing that, right? If you're like, I don't know, because theater sounded cool, like you're not gonna like, but you say like, I have this question, I have this interest, this is what I think. And you of course do your background research and make sure you understand like why this school, why this program. But yeah, absolutely. Just like Jackie said, like the places I, applied to, they were like, oh, that's different. Tell me why you're applying here. And in many ways, it makes you stand out. But it just needs to be an authentic, I think you are the people who can help me answer the questions and learn what I need to learn. And absolutely, absolutely. And I'll say, even for medical school, we have plenty of medical students who are English undergrads, art history undergrads, and it's about how they apply what they're doing and why they think they want to go here. We actually have a someone he's very open about this, but like he's a student now. He was an elevator designer, engineer, a mechanic for like 20 years and then came back to be a physician. And he's one of our great, fantastic students because he was so clear about why he was making this switch. So yes, at any point in your life or career, you can do something entirely different, especially if you're clear about why. And it's not just I'm bored or that seems cool. It's I have this burning desire to understand this. Absolutely.
And I would also advise that you reach out to whoever is the student like the academic advisor for the program, and pick their brain about it. Find out a little bit about how accepting that program is of multiple disciplines, why or why not. Also, then once you've done that, you can talk to some faculty in the program and kind of explore that way as well. I have to say that when I did the PhD in nursing, and for me, that was probably a bigger jump than going from theater to gerontology. Long story, but nursing, you know, is a discipline where people get licensure. And so in some places, it's very shocking for them to hear of a PhD program in nursing accepting people who are not nurses. And so I did talk to the program advisor, found out why. Why would they accept someone who wasn't a nurse, and better understanding what the program was looking at and from that perspective. If I had talked to some other PhD programs across the country in nursing, I know they would have said, no, we don't accept people who are not nurses. So you don't give up if the first program you talk to says they're not open to other disciplines. Explore other ones as well and find out if that's across the board. The College of Nursing at the University of Utah is very innovative and forward thinking, and they're one of the first programs that has done this, and other programs now are following suit. So who's being innovative? Who's thinking outside the box? Who's thinking across disciplines?
And is there an advisor there you can work with? So
Yeah.
I got turned down for plenty of PhD programs, and in several cases it was like, we think what you're doing is really interesting. We don't have an advisor for you. Like, there's not a person here who can guide you. And yeah, so just be ready for some rejections. But yeah, you can absolutely do it, and it's worth it if you're really passionate about it.
That's awesome. I think like I just had a moment during this discussion that I was like, that's interesting. I guess I don't have to continue like engineering if like I can apply it towards something else.
Yes. Exactly. It's about the question. It's about the purpose that you feel, and you find the place that can help you do that. And that might be engineering, and it might be sociology. And you have an engineer on your dissertation committee, you know, it just depends. It depends on a lot of things.
We are 1 minute over time, so we're going to end it, even though this is such a good, I think, really wonderful conversation. And thank you, Jackie and Gretchen, both so much for having the conversation.